kids are curious creatures, and if they see something that's different from themselves and they don't understand it, they could be fearful of it. So it is, I've noticed a lot of teachers are starting, or not a lot, but a good handful of teachers are starting to buy these toys to have in their classrooms. And I think that's wonderful because it really is, it's starting the conversation, and it's providing like a safe and comfortable environment for kids to learn and ask questions.
Welcome to Complex Conversations, brought to you by the Blue Bee Collective. I'm your host, Chasity Short, and I'm so glad you're here. Complex Conversations in the Blue Bee Collective exist to provide education, advocacy, and empowerment to families living lives with medically complex children. Today, we are joined by Mary Jenner of the Butterfly Pig. She is the founder and owner, and the Butterfly Pig creates medical play devices that are exact replicas of real medical equipment. She has everything from hearing aids and cochlear implants to canes for the blind, halos, feeding pumps, trachs with ventilators, anything you can imagine. Mary either already has it or she's in the process of creating it. And just in time for the holidays, she also has devices that go along with the Elf on the Shelf, including its very own feeding pump and candy cane formula bag. Because let's face it, we know that candy canes are one of the 4 major food groups. So please go to the show notes today, visit her site, and get those orders in as soon as possible so she can get them shipped out just in time for the holidays. We're so happy to talk to Mary, and I'm so happy you're here. Mary, thanks so much for joining us. I'm so excited to have you. You're one of my very favorite accounts on Instagram, and I love seeing all the new stuff you come out with. So can you start by telling us a little bit about who you are and what you do?
Yes, absolutely. So, I am on here because I own the company, the Butterfly Pig, and we make toy medical devices to aid in play therapy in the home and at the hospital. And how I came about opening this company is because I'm a nurse, and I started my career in pediatric oncology. And I always found it to be so much easier to do procedures on the kids when they understood what was going on and they were involved in their care. So I would do that by teaching them with our stuffed animals. So that's kind of where the whole idea came to fruition, that we need more toys for the medical field.
It's so needed. So I worked at a pediatric hospital for 15 years, and they had some playthings. And then when I had my own kid with special needs, I kind of made my own trach babies and G-button
Oh, yeah.
dolls, and use some actual real medical equipment that if we had extra or whatever that kids could play with. But when I came across your account and everything's miniature and doll sized, I was like, oh, this is what we've all been looking for. It's
Yeah.
so amazing. So can you tell us what kind of stuff you have?
Yeah. So it started with just the smaller items like hearing aids, cochlear implants, and continuous glucose monitors. And at that point, I was making it out of clay. So it was a little hard to do for the demand we were getting. So then once we switched over to 3D printing, that kind of opened up the realm of possibilities. So I have a lot of the stuff behind me, as you can see. We have feeding pumps, AAC tablets, orthotics like AFOs, SMOs. We have bigger items like echo machines. We have cast saws. We have I think we have 63 or 64 different devices now, and they're
Wow.
counting. We have, I think, every couple of weeks we come out with a new one.
That's such the cool thing about your company is just when I think, well, man, she's got it covered, you put something
Yeah.
else out that I'm like, I would have never thought of that. And you're
Yeah.
so good about representation along the continuum of kiddos who have medical issues. So
Yeah.
what sizes, like your hearing aids and cochlear implants and that sort of stuff, what size dolls are those meant for?
They fit like baby dolls up to American Girl dolls. Those all seem to have the same size ears.
Okay.
So most of these devices I would say would be like 13-inch to 18-inch dolls.
Okay.
Except like Barbies, since they're so small, those we're actually coming out with a separate line of stuff. So we have like a scoliosis back brace for Barbies and the ear defenders. But like the hearing aids and stuff don't work on those right now. But yeah, so it's mainly like baby dolls to American Girl size dolls.
Yeah, that's perfect. And that's just the right size too for a lot of kiddos. who don't have the best dexterity in their hands to be able to handle, um, with those sizes. So,
Yeah, and it
so
worked on a lot of stuffed animals too, around that
oh
same
yeah,
size,
yeah,
because
I've
we have a
seen you
lot of
put stuff on
sewable
stuffed
items.
animals, and you
Yeah.
also have stuff for your elf on the shelves. Isn't that right?
Yes.
Tell
Yes,
me
we
about
do.
that.
Yeah, I actually here's one of the elves. Um, we have the elf on the shelf ear defenders. We have a Christmas feeding pump, which I do have up on the free arm right there. And it has little candy canes that connect into it. Because in the movie Elf, candy canes are one of the five major food groups.
Yes.
So we have that, and then we have a little elf-sized AAC and the scoliosis back brace for those too. So that
Oh my
was new
gosh.
this year.
That is so cool. I love that so
Yeah.
much. And just the feeding pumps that the kids can, when I think of like medical play, I always think of trauma, but
Mhm.
really just representation. So even if a
Right.
kiddo doesn't have any medical issues, just so they can, I think part of like my passion and what I want to do is to make disability normal. I
Right.
want everyone to know how to come up to somebody with a disability and treat them like they would treat everybody else. And these
Exactly.
toys are perfect because it normalizes the way other people communicate or hear or eat,
Mhm.
right?
Yeah. Yeah, it helps build the foundation of, like, just embracing other people's differences. So, if kids can be introduced to medical differences early on, then it's not so different to them. It's,
Hmm.
just kinda normalizing that.
It's I think this needs to be everywhere, in every hospital, in every school. So I've told the story before, but when my son was in school, I would go every year and do a presentation to his grade. And so, like, I think last year I did it. I think he was maybe in third grade. And so all the third graders came to the library, and I had given trachs. I drilled holes in the necks of all our baby dolls. And so every baby
Oh,
doll had a
yeah.
trach. And then when he would need a new G button, I would wash the old one really, really well, sterilize it, and then put it in
Mhm.
the doll. And I let the whole class come and touch the trachs and suction the trachs and, do all
Mhm.
that stuff. And that opened up so much communication and acceptance and broke down so many barriers because they weren't scared of
Yeah.
that thing in his neck. And
Right.
I think that's why I'm so excited about the butterfly pig and what you're doing
Yeah.
with that because I have that personal experience.
Right. And like kids are curious creatures, and if they see something that's different from themselves and they don't understand it, they could be fearful of it. So it is
Mhm.
I've noticed a lot of teachers are starting, or not a lot, but a good handful of teachers are starting to buy these toys to have in their classrooms. And I think that's wonderful because it really is, it's starting the conversation, and it's providing like a safe and comfortable environment for kids to learn and ask questions. And yeah, it really
Mhm.
just helps facilitate those conversations.
Well, and not being put on the spot. So a lot of times we'd be out in
Mhm.
public and a kid's curious and he wants to know, why does that other kid look like that? Why is he sitting in that chair?
Yeah.
And the parents are mortified because they don't know how to handle it. So I think even
Mhm.
having these toys where the parents can experience, oh, I've never seen a hearing aid up close. This is a toy, but let me
Right.
be able to examine it so I can feel comfortable with it and know what to say to my own kid.
Right. It definitely helps because I know my daughter, she asks what everything is. And I think it does, playing with a toy, you're not put on the spot. So it's much easier to think, okay, how do I explain what this is without like going over their head, or, using language they won't understand. And so it's been kind of challenging for me to try to figure out how to like educate my own daughter. And it's really neat because she absorbs so much more than I thought that a 4-year-old could. Like, I feel like she knows about every single disability possible right now. So
Yeah.
it's been really helpful.
I mean, you're equipping her so well, so when she's in the playground and she's a kid with a cochlear implant, she's not
Mhm.
gonna care. She'll be like, "Oh, yeah, I know what that is. My doll has one. Now let's go down the
Yes.
slide." It's
Yeah,
not gonna be
she gets
scary.
excited too when she sees stuff. She's like, "Oh, hey, he has a back brace," and then she'll just go on with her day.
Yeah.
So it's kinda neat that, yeah,
She's
she just
sees
excited
a
to
kid on a
recognize it.
feeding pump, and she's like, "Our
Yeah,
elf has a feeding pump." They're like,
right,
"What?"
and they'll be
You're
yep.
That's really cool. So,
Yeah.
what is I guess the hottest item that you have right now that what you've
That's a
sold the most of or that you're
good
selling the most of?
question. I would say right now, just because 'cause we're so close to the holidays, it's the elf, feeding pump because people are just trying to get that before Christmas. Um, So that's probably the most popular. That line, even the other non-holiday feeding pumps are probably the most popular because Moog, the brand that makes the Infinity pumps, they actually provided me with a license to use their exact logo and everything. So that it looks almost identical to their feeding pumps. And I think a lot of people like that about it. And the little fruit feeding bags are pretty cute too. So that's probably my favorite too. So definitely the feeding pump line is our most popular.
Yeah, when I first saw the feeding pumps and, anybody that has a kid on a pump, it's I don't it's a different experience. When I first saw it, I was like, "How did she get it to look exactly the same?"
Yeah.
So I'm glad it's a licensing thing. I didn't even think about that. Of course,
Yeah. Before when I first did it, I changed the words instead of infinity, it was dolphinity. And they actually were the ones to reach out and they said, we like this. We want you to use our name. So it was a really neat process. But that's
that's really
my
cool.
probably my favorite thing is like making the stickers and screens to try to look exactly like it. I love doing that type of stuff. It's fun.
So, you just saw the need and you just decided to do it. Like you just saw this was a need and you started making it out of clay? Is that what you said?
Yeah, yeah, it was so I've
That sounds
always
tedious.
I know I even when I was going into nursing, I knew I'd want to do something creative on the side because I feel like I don't know, I've always had that desire. I just didn't know what. And so once I was in nursing and then I saw this need, I'm like, "Okay, gosh, I don't even know how to start this process." But mid-pandemic on maternity leave, I had more time. I was at home with my daughter and I'm like, "Gosh, I like what could I do to kind of start this idea?" And so I just started making out of clay because I there was somebody asking for a cochlear implant to match her daughter's doll. And then the requests started coming in and I'm like, yes, this could be a thing. So then I invested in 3D printers and started trying to teach myself CAD software. Now my dad, a retired engineer, is helping me with the designs because
Oh,
it's funny,
perfect.
even the stuff that I was designing, he'll even go back now and the steps it took me to make one thing, you can scroll and see it. It takes me so long to design one thing because I'm not an engineer by trade, but he's much faster at it now. So yeah, I
Yeah.
saw that and I just started making the designs and every single design we have is made per the request of a parent or a like hospital child life specialist. So that's how we have like maybe 30 or 40 designs in our queue that we still need to make. And I keep adding to it as people send in requests. So we're constantly pumping out new stuff.
So you do the printing at your house then?
I did actually. So I just in September, we finally where I am now is 1,000 square foot place that's just like 5 minutes away from my house, thankfully. Because before we had 12 printers in our house,
It's a
and
lot.
and they're not super loud, but they were in my husband's office, and he works from home, so
Oh,
it was
no.
kind of a lot. And then I once I realized I needed people to help, like pack orders and stuff, it just didn't work with having them come to my house. So we started looking for a space. And in September, we got this 1,000 square foot space and we filled it up. I didn't realize how much stuff we had at our house. It was like our whole entire garage was full of it.
All of a sudden, you got a giant house because everything was out of it and you had room
You
to
know,
actually live
oh,
in
that's
it.
already filled up again. Toys and like
Yes.
it just, we just reshifted things around.
Yeah. It seems like you're growing really fast and you're working really hard to meet the demands that are kind of being placed on you and the new ideas. I love that you get your ideas from parents,
Hmm.
from child life specialists too, but from parents that are
Yeah.
like, we have this, can you? And you have canes also, don't you?
Yes. Yeah, we have the folding long canes and
Hmm.
we have derby canes too. So yeah, in all the requests, I'll come up with ideas that I think would be great, but who knows if it would even help anybody. So I really just wait until somebody requests. And like I would feel weird putting what I think would be a great design in front of somebody who actually needs something. So that's why we go just off the design queue right now. So it's
Yeah.
really just whatever people have been asking for.
I mean, it's a perfect model. I mean, really, this is
Yeah.
something that I think should be in every house. every doctor's office,
Yeah,
every therapy clinic, every pediatric
right.
hospital. Um, I can't think of a place
The
it wouldn't be
dull.
beneficial.
I know. Yeah, I it's funny that it hasn't been a thing yet because like now that we're so deep into this process, we're just like, how come this hasn't been done before? But
Mhm.
then with the medical field, the devices are changing all the time. There's like a vent that we designed, I guess just got recalled in real life. So we're like, okay, now we got to design a new vent. So
Yeah.
it's like there's constant changing. So I see why other like toy companies haven't been able to do it. So it's yeah, it's really opened up a unique area for us to kind of champion in.
hmm Yeah, I can see that. Their manufacturing process is probably like the Titanic, where you're more like a
Yeah,
speedboat. You can move
right.
as you need to,
Yeah, they
and they
do like
really can't.
injection molding and yeah, they once they are set on a design, they're stuck on it. Whereas it's been nice because we'll design something and then if a customer is like, hey, this is a little hard to open or something, we can just change it right away and then fix. So it's really neat that we've been able to just kind of adjust as needed and improve on the products too.
And what's been your favorite design so far? If you do you or if you have one?
You know, there's a couple because I would say the feeding pump was probably my favorite because I love the little feeding bags. But I also really like the nebulizer bears because those have little masks that you can put in it. And I just think the nebulizer bears are super cute. And the halo, the neck brace, that was one
Mm.
that was on our list for months. And with everything, I don't ever delete anything off our queue. But like with that one, when I first put it on there, I'm like, there's no way we're going to be able to make a halo. This is way too intricate. Like, I don't know how we're going to be able to make it. But then as we get more experience and we're doing designs, we're like, wait a minute, like that material we used with that one, we could use. So we're able to make more complex designs. So when we finally made the halo, I was so excited because it was something when I first put it on the queue, I was like, I don't know how I'm going to make this work. And so that's
Mhm.
one of my favorite ones just recently, but yeah, really excited
Well, and
about it.
that's a representation I think that working at a pediatric hospital, lots of kids have halos, but you don't see a
Mhm.
lot of halos out in public. So those kids that do
Right.
have it, I'm sure that is just their favorite thing because they're like, oh, look, someone else looks like me with this, these rods around my
Right.
head and screwed into my
Yeah.
head. Um, oh, what was I going to say? So tell us a little bit. So you have the feeding pump, you have the
Mhm.
halo, you have the AAC devices, hearing aids, cochlear implants. What am I missing?
Oh gosh. So we have central lines like PIC lines, Hickman Broviac ports. We have, Maya Reservoir where there's kind of like a port underneath the skin of the head that goes into the intrathecal space for different infusions like chemo or different types of things. Um, we have syringe infusion pumps for like immunotherapy at home. There's forearm crutches. We have all the hearing devices and cardiac stuff, pulse socks, cardiac monitor. We just designed the implanted like cardioverter device. And then we have diabetes stuff. We have medication pens, glucose monitors, insulin pumps. There's so much. So we're trying to get all the different kind of main categories. Um, yeah, and then we have like
Mm-hmm.
the vent, inhaler, CPAP mask, oxygen tank. It's just, yeah, I could go on.
Oh, that makes
Yeah,
me so happy.
yeah.
Do you have a trach yet?
We do. We do have a little trach. It's a trach with ribbons so you can tie it on. So it can be
Okay,
tied on.
awesome.
It can either be tied on to like a hard body dollar stuffed animal, or there's also two little holes so it could be sewn onto a stuffed animal or soft doll as well.
That's awesome.
Yeah.
So people aren't having to use trachs like I did
Right.
back
I know.
back
And
in the
and
day.
the trachs that we have, it actually can connect to the ventilator as well. And then we're working on getting it to connect to some other things too. So
Oh my,
we
that's so cool.
try to make everything like work together. So like the
hmm
G tube we have opens and the feeding pump plugs into it. So we're trying to make it all like very hands-on for the kids to play with.
What are some, have you gotten testimonials from parents or anything that motivates you to keep going if you're like, "This is maybe too
Oh,
much," and
yes.
then, you get that testimonial come in and you're like, "Nope, I'm gonna keep doing it."
Yeah, I can't tell you how many times I've thought it was too much, especially because we opened in 2020 and I was still doing nursing until April of this year. So it's almost 3 years. This was like a side hobby for me, and it was way too much to do with nursing. So then in April, I started focusing on this full time. But even I would say everybody that has been a customer of ours is just so nice, and we get so much good feedback. I'm pretty bad about saving the feedback to like look back on, but I've gotten so many tags on Instagram and stuff of like their kids opening the gifts and just like long messages even before they get the items. Sometimes I'll just get like an email just how excited they are to finally find our company. So all of that keeps us going. It is so nice to see that we actually are making an impact.
Mhm,
And I'm the one that's in charge of the social media, but I do have my dad's a big part of the business now in helping design everything. So I've been sharing it with him because he doesn't get to see that normally. And so that's always really neat for him to see now that like what we're doing is making a difference. So
mhm.
even though it's like very time consuming, like it's doing good things out there.
It's very, very important. I mean, I can honestly
Yeah.
see this blowing up, where you're gonna be in a
Yeah.
10,000 square foot space in no time, have employees, like, I can see this once the hospitals and those, once they get wind of what you're doing, it's so important. And it may
Yeah.
seem, silly to some people listening, like, "Oh, she makes toys." No, no,
Right.
no. These are not toys. This is
Yeah.
so important for, I mean, so much of the bigger, uh, the bigger picture, the representation, or
Mhm.
even like anytime my son would be in the hospital and he'd get a new thing, like he got an ileostomy and
Mhm.
working with child life. And she brought in an ileostomy bag, but they
Mhm.
can't waste resources. So they weren't
Yeah.
able to, the bag was too big for the doll. And you know what I mean? Like if we had a
Yeah.
doll size where they could, on their own time, without the child life specialist kind of staring at them,
Right.
explore it. Cause that's a really scary thing, right? For a lot of
Yeah.
kids. And yeah, once people get wind of this, it's over, sister. So
I
you
know.
think you're tired now. I think you're gonna get a lot
I
more
know.
tired.
We
Uh,
yeah, we have a couple hospitals that we're vendors with now, so the child life specialists are making routine orders, and then we're in the works of possibly partnering with several different clinical trials where they want to provide the toys to the clinical trial participants to help kind of ease anxiety in the children. So
mhm.
there are definitely in the medical field, more people are becoming aware of us and wanting to provide it to their patients. And I think that's wonderful. So it's, yeah, we're just going wherever the wind blows us because I don't know where it's going to go from here.
That's always the best thing, right? You're like, we're just going. We're waking
Yeah.
up every day and getting new orders.
Yeah.
Um, have you, since you have the plastic that you make the feeding bags out of, have you considered
Mhm.
making an ostomy bag?
Yes. So that has been, I had an ostomy bag once upon a time that I made, and it was very time consuming. So we are trying to revamp the process. Right now, the thing we use for the feeding bag is like a so it's the clear vinyl, but it's a straight line that seals it. So right now we can only do straight lines, but I did find a company that will make a custom like sealer. So I'm trying to figure out how we can do that to get a more like ostomy bag type shape because I think that would probably be the best way to go about it. I wanted like that tan color too,
Hmm.
so I'm having a hard time finding a material that would be able to like heat press that's still
Did
kind of the
you?
color of ostomy bags. So
Yeah.
I'm looking into it.
Well, you could also do clear and put candy canes in it for Christmas. Candy canes in, candy canes out.
Yeah. That's a good point. Yeah, I
Yeah.
know. I have to that's definitely in our design queue, and it's something I go back to frequently to try to work on and figure out how we're going to be able to do it and reproduce it.
That makes me happy it's in your design queue. Uh,
Yes.
That's my request, but it's already there. So,
Yeah.
so that's good. Yeah.
Yeah, and
And,
I definitely wanna make
I
a
know when,
stoma because I think a little stoma
oh, what
button
is
would be
that?
cute. Like the
Oh, stoma.
actual
Yes.
yeah, like,
Yeah.
make it so it can be sewn on a stuffed animal, but I was like, "I can't release the stoma without a bag because then the kids are gonna be like, 'Oh, no, they're gonna poop everywhere.'" So I need to figure that out together.
Yeah. I thought you said spilma. I was like, I've never heard of a
Oh, no.
spilma. What's that? Stoma.
I'm
Yeah.
congested, so my yeah.
No, that's great. Yeah, I mean, a lot of the siblings of kiddos with, these medical issues too, they get so involved in the care. Like my two
Yes.
sons, they would help sometimes, but not really. But my daughter, she was little, but she loved helping, changing the ostomy bag and
Yeah.
feeding and even trach care,
Oh, she
booty
might be a
care.
nurse when she's older.
Well, yeah, she's in high school now, and
Oh,
she's wanting
yeah.
to be a PA. So,
Oh, okay, yeah.
but yeah, I was like, well, you actually know more than most nursing students, I'll tell you,
Oh,
because
yeah,
you had hands
100%.
on for so long. Um,
Yeah.
but yeah, having stuff like that would be, and she would, when I would be feeding him, she would bring her baby doll out with her G button and she would feed her
Aw,
baby. And
yeah.
it's just such a beautiful way to grow up. I think, honestly, for
Mhm.
siblings that have complex siblings, I think
Yes.
it can be a difficult way to grow up. It's very atypical, it's different, but it can be such a beautiful way. And I feel like these
Yes.
things that you're producing, it just aids that whole process so much.
Yeah.
I love it.
Yeah, I love seeing all that on because now with this company, I'm following so many accounts across social media of children with complex medical needs, and
Mhm.
it's really neat to see the sibling involvement for sure. And I've heard that a lot of just like how much it's helped those siblings grow and just become such understanding people too.
Mhm. Well, and they internalize what's happening around them through play. That's how children
Hmm.
learn and grow and,
Yeah,
kind of figure out life is through play. And it's just
yeah,
vital. It really is. And I think if a kid can't freely and safely explore those ideas and what's happening around them in play, it's going to internalize into trauma or,
exactly.
other things that will have negative effects in the end.
Well, that I just recently learned that not every hospital has a child life department. I don't know why that was news to me, but I'm just thinking, oh my goodness, like all these kids that don't even have access to child life in the hospital, who's encouraging the play and like helping them understand what's going on? So that's, yeah, there's a big need for more child life specialists out there too. So yeah, there,
Yeah, I have a friend, a really good friend who's a child life specialist that I worked with when we were at the hospital together. And now she has a private practice. And so we work
okay.
together in our private businesses. And that's what she was saying. She's like, the places where people can go to do their hours to become a child life specialist are so few. It's
Oh
really this
yeah.
kind of pigeonholed, community. And every pediatric hospital needs to have a child life department. I don't
Yes.
understand how you can do, because the same things you do to adults, you do to children. They're
Mm-hmm.
painful, they take a long time. There's a lot of
Yeah.
trauma involved. And if in the I mean, the nurses do their best, I know, but they're also having to do their nursing jobs.
Yeah, in nursing, you don't learn how to like make it kid friendly. That's not taught because the nursing school is nursing school. They're not you get a class on peds, but it's not like this is how you make something less scary. It's just in like even in pediatric oncology, like I can't tell you how many times for like accessing a port, they just say, okay, just wrap them in a blanket and hold them down. And it's just like, oh, like if you just explain to them, like it was just so hard to see that because typically if you were able to explain to them what the process was going to be like, they had the numbing cream on. Like if they could practice it on their stuffed animal, like it would be so much less intimidating for them. But like coming back time and time again, it's traumatizing to them. So just getting their port accessed over and over without anybody there to help guide them through in like a kid friendly way, it was really heartbreaking to see.
Yeah. Well, and
Yeah.
having that play not only to prepare for the traumatic event or I'm not, I don't want to assign trauma to it, but to prepare
Right.
for the event that's uncomfortable or painful, but then
Yeah.
also having the freedom to act that out afterwards, to deal
Yes.
with that I really didn't like that. That made me sad and scared and it hurt me.
Yeah.
And I'm going to be able to now to act this out in kind of the safe way with these
Yeah.
tools to help me really kind of internalize what's happening,
Yeah.
rather than it being, I was hurt and now I'm
Yes.
terrified, because you're going to
Right.
have to get accessed again. That's just the way the treatment goes.
Yep.
Um,
Yeah,
I,
definitely to help process it.
I was lucky enough where I worked, it was very family centered and child centered. And they had a huge team of child life specialists.
Okay.
And we worked with them a lot with my own son. And then I worked with them because I did wound and burn care there for a long time.
Oh, yeah.
And so they would come in during wound care and I would totally just get in my zone of like, this is
Yeah.
what I'm treating. And then that child life specialist would come in and
Yeah.
bring everything full picture. And she would often, I would realize, okay, there's a human connected to this wound. Like I know that I'm a mother
Right.
and, but they play such a vital role. Um, maybe that's what we
Yeah.
should do. We'll just start getting child life specialists at every pediatric hospital and then they can
Yeah.
go with you and get all your stuff and it'll be great.
Yeah. I
Um,
did pediatric burns for a little while too.
you
And
did?
that hospital, I don't know, because I only worked there for like 7 months, and I don't know if they didn't have child life, but on my unit, they didn't come up there, but it was the ICU. So I wonder if it's because the kids were mainly like on fentanyl, so they weren't really aware. But still, that would have been so helpful to have them there, especially during the
Mm-hmm.
wound changes,
Yeah,
dressing changes.
absolutely.
But
It's crazy to
yeah,
me. I didn't think about that, but
yeah,
yeah, you're right. It's crazy to me that a lot of hospitals don't have that. So
right.
I know you've worked with Infinity pumps. Is there any
hmm
other big brands that you've reached out to or they've reached out to you to work about making the doll sizes of their equipment?
The only I've been pretty bad about reaching out to people just because I don't have that much time. That's on my list. I want to reach out to a lot more. But Free Arm, are you familiar with Free Arm?
I'm not.
It's
Mm-mm.
oh my gosh, I wish I had the real one here. Um, because Free Arm it's like a mobile IV pulse. So they reached out to me, and Misty is the owner of the company. She asked us if we'd be able to make a toy size of hers. So that's the only other one that like reached out. But it's there. Of course, you need to see theirs. This is just a toy, but it's like a mobile IV pole that's bendy, so it connects to like any surface, and she even has it where it can connect to backpacks and things. So it's pretty cool. So that's the other company that we've reached out with and have like a partnership with to make their product.
That's great. Okay, so
Yeah.
would it be okay if I ask you to take some stuff down from the wall and show us?
Yeah, of course. Is there anything
Okay,
specifically?
so right now, if you're listening on Spotify, go ahead and switch to the mode where you can see the video. You just exit car mode, or you can go over to YouTube. We're at minute 31. I guess there'll be a little bit more of the once I add the intro here. And so I want everyone to be able to see some of these toys because they're really, really impressive with how lifelike they are. Yeah, show us an AAC device, maybe hearing
Yeah.
aid.
I wonder if this will let me. I have it like
It might be
okay, it's not
secured.
coming off. But
That's okay.
like here's this is like the Echo machine, and it actually does have a little ball that spins because that's I know a lot of kids like watching that part of the procedure in this so they can put the little probe on their stuffed animal. And it
That's
has
awesome.
different screens, like ultrasound screens too for kids that get ultrasounds. We for our pulse oximeter here, it fits on most doll fingers, and it actually does like open too. So
That's
that
so cool.
opens up. There's a lot of interactive stuff. The kangaroo pump we actually made to open up and kind of look like the real thing with like the thumb tab. So it's able to be loaded kind of like the real device. Um,
Can you show us that one more time, but
oh
bring that
yeah.
up and kind of hold it
Oh yeah,
still so
sorry.
we can see it?
So here's the
Yeah.
inside of it, and then these
Yeah.
are like the
It does look similar
connectors.
to the inside.
Yeah.
Okay, awesome. Yeah,
And
so
then
if you're not listening right now, a feeding pump is basically a plastic box and it has these moving, like kind of like a moving gear inside that pushes the food through the tube that's connected to the belly where the child's getting fed. And so she's been able to make the toy so that it has these parts on the inside that are interactive for the kids so they can load the feed up just like the mom or the nurse loads the feed up.
yeah, and then here's a bone anchored hearing aid headband, and here's our infusion pump, which opens up, and
Opens.
this is like our little bag of pretend IV fluids. And connected to it is our Hickman Broviac line right now. And the clave actually unscrews. This part is a little softer material, so if a younger kid can't do the screwing motion, they could just push it in too.
Okay.
And
So
then,
that
yeah,
the kiddos who need different medicines infused right into, well, there's central ports, so there's PICC lines. If an IV isn't strong enough to hold the medicine that they're getting or the volume or the toxicity of the medicine they're getting, then they'll have a central line put in their chest or in their arm. They'll have a PICC line. And so they'll connect these different, like she said, the Broviac, there are these different lines that they put in there to put different medicines in. So they even have not just regular IVs, but they have actual, that's really cool,
yeah.
actual central line
And
tubes.
this is a port. So typically with a child, the port would be under the skin, but for teaching purposes, it would just be sewn on top of a soft doll or stuffed animal. And this is the little pretend needle with a clave on the end they can screw into the infusion pump, and it just pops right in there.
Awesome.
So
And
they
the
can,
clave is what attaches that little line to the line with the medicine, right? It's kind of like the
yes.
little screw
Yeah.
port.
And then
For,
I'm going to take the headphones off while I grab a couple others.
okay. So hopefully you guys can see right now if you're just listening. She's got a whole board behind her. She has a really cute little halo. Kiddos who have unstabilized cervical spines from surgeries or accidents, they'll sometimes a halo is the metal thing that goes around your head and it will screw into your skull bones and it kind of holds everything still to give your neck a chance to heal. So she's grabbing all kinds of stuff right now. She also has earphones that it would be for play for kiddos with like sensory issues or kids on the spectrum. I see some AAC tablets. We've talked about that before on the podcast, but that's basically a communication device for kiddos who are nonverbal, and they can use that to help communicate with other people. Okay, she's back.
And so this is our inhaler and spacer. And the inhaler pushes down. So a lot of
That's really
kids like to
cool.
play with that one.
So not just for medically complex kids, just kiddos who have asthma too. Okay,
Yes.
perfect.
There's a urinary bag. So comes with a little Velcro strap, so it could be strapped around the leg of the stuffed animal or doll. And then, yeah, and it even disconnects. So, like some kids, I guess, wouldn't have to be connected to it all the time. So this part can just be in their stuffed animal or doll, and then when they need it, they could connect it to the bag.
Okay, so this is a catheter for kiddos who aren't able to urinate the regular way. Sometimes they'll be cathed, where a line's put into their urethra to collect the urine. My son actually had this. I would have loved that toy.
Oh yeah,
And
yeah.
then there's a bag sometimes for kiddos in chairs or people in chairs that it'll strap on their leg to help give a place for the urine to drain. So some of
Yeah.
the stuff might sound like, ooh, that's kind of gross, but this is real life for a lot of people.
Mm-hmm.
And so we're not going to shy away and be scared because it's quote unquote gross because everyone pees and some people
Yeah.
just pee in a bag.
Yep. And here's the halo I was talking about earlier.
Oh my gosh,
Um,
that is so cute.
I know, and it so it has Velcro, so it can fit on a variety of sizes, and then yeah, it kind of pops in and out to assemble it or to put it on the doll. So it's yeah, pretty simple and flexible, so it can fit different sizes. So it is, yeah, this normally in real life this would be drilled into the head, but of course
Mm-hmm.
we're not going to do that to the stuffed animal or doll. It's kind of difficult, so it just has that appearance.
Well, if I had the halo, it would definitely have been drilled in because I drilled holes in all of our
Oh
dolls
yeah.
for the trachs.
Yeah.
So your instructions: get a 1/4 inch drill bit and
Yeah. Oh, I've pondered that idea before, and I was like, I don't know if people would do that.
Yeah, yeah.
This is a chest tube drain. So this part has little holes on it so it can be sewn into the side of a stuffed animal or doll. And then it even has the little kickstand. So a lot of
Oh, I
kids.
didn't know you had that.
Yeah, this one's kind of new. This was actually per the request of the mom of the boy with the hypoplastic left heart syndrome. Um, she was talking about how this is really hard in the hospitals after surgeries because it's so uncomfortable for kids to have these hooked up to them. But often, if they have buildup of fluid, they need the drains. So this way, their little stuffed animal or doll could match them now.
That's so cool. I would have never thought to make that.
Yeah. Here's a one of the folding long canes. It does fold. So we have that. And we have them in a couple different when it's striped like this, I believe that's when they have um when they're deaf and blind.
Okay.
So then they have like different meanings. The red on the bottom is low but some usable vision, and then the all white is completely blind.
All right, so these are like little miniature walking, not walking canes, but canes for people with visual impairment or who are blind
Yes.
that their little dolls can use.
And then we also, this was for Shriners actually, they requested a cast saw because this is kind of an intimidating procedure.
Mm-hmm.
So we made it where it makes sound. So it kind of helps desensitize prior to the saw being or the cast being taken off. And the pop tube makes it a little extra fun to play with. And the cast that you get with it, it actually has a little groove. So when they pretend saw it, it pops off. So that's
That's
another
great.
fun interactive one. And we have this is the ventilator. And this, it's actually, although this connects to the trach, if you get the trach option, this is the ETT, the
Mm-hmm.
endotracheal tube. So if they have it like a tube that goes in their mouth and down their throat, the parent that requested this, their kid didn't have it anymore, but to process like the trauma she felt going through that after an accident, they wanted this for the stuffed animal
So
for her to
a little
process that.
trach with a ventilator that attaches to it.
Yeah. And then we also have an oxygen tank with a little nasal cannula. So you can wrap around the ears and this part slides so it can be fit to different size heads. So this is a
It's
cute
so
one.
cute. Looks just like
I
a real
love it.
oxygen tank.
Yep. And then here's the nebulizer I mentioned earlier that I really like. Um, because we made it to look, they actually have a little blue bear nebulizer. So we thought this would be a cute option. And a lot of the masks in real life come with little animals on them. So we
Mm-hmm.
have a few different animal options. And there's a couple different masks. So you can even swap out the masks if you wanted to do different ones.
To get breathing
Um,
treatments. Yeah.
yeah. So there's
Yeah,
that.
and
Yeah.
you could use that with the trach kit too, because we would give
Yes,
breathing
I
treatments,
know.
right?
I was,
Put the mask
yep.
over the trach.
Oh, yeah. And then we have a walker. That was the other one I grabbed,
Oh,
or
I was
gate
gonna ask
trainer.
about that if you had a walker.
Yeah. So this one,
And
it's
it's pink.
yeah, it does come in silver too, but this is my favorite color of it. So
Yeah. Do you have any
yeah,
plans to make a wheelchair? Or is
we
that
actually
seems
did make
really
one.
intricate. Oh, you
I'm
did.
looking I'm looking at it on the shelf right now. Um, we made one and the hard part is because there's so many different pieces and it is so intricate, it was hard shipping it long distances. So right now we've kind of tabled it and we're trying to figure out a way to make it stronger or what we can do to it because it did not like the rustle and bustle of shipping. So
Mm-hmm.
we have to figure that out before we can release it again. But we did make one.
Well, you're doing amazing work. Do you have anything that you'd like to say before we hop off?
I even if people don't have a need for our toys, just sharing about it, so the people who need them are aware, that is hugely important and helpful. So, yeah, anybody who's listened to this, I just appreciate them taking the time to.
Good. Well, I'm going to put this, this will be out on the 11th. So the cutoff date for USPS shipping for to get in time for Christmas is the 16th,
Mhm.
right? So if you're listening to this, you need to make your order today before she sells out of everything. I am really, there's a lot of accounts that I really enjoy, but there's not many that I feel really passionate about. And this is one of the companies that I feel very passionate about. As soon as I found y'all, I devoured your whole feed. And,
Yeah.
I love to share your stuff because, having both worked in this environment in the hospital and in clinics and in homes of children who are disabled or have complex medical needs,
Mhm.
and then having my own medically fragile kid and navigating that life with not only him, he couldn't play with these toys, but all his siblings could, all his siblings'
Mhm.
friends, his schoolmates, his classmates at school. I feel like it would have made our life so much easier and made him so much more accessible and approachable. So
Yeah.
I couldn't recommend you more, to be honest with
Oh,
you.
yeah. No, thank
So
you so much.
yeah, of course. I'm going to put all your links down in the show notes. So please go down there and visit her store, and let's keep her really busy so that she needs a time to rest after Christmas.
Yeah.
All right. Thanks so much for coming on, Mary. And everyone go visit the Butterfly Pig. Until next time, have a good week.
Thank you.
Thanks for listening to this episode of Complex Conversations. I hope you enjoyed the show. Please share this episode and the show itself with your friends who you feel like could benefit from it. And please hit that subscribe or follow button. That'll really help us out. Head on over to bluebeecollective.com to learn all about the brand new Blue Bee community. This is a community where we're going to be bringing together parents and caregivers of medically complex children with complex care providers. The goal is to build up an empowered and fierce complex community to help you live your very best life. Thanks again for listening, and remember, you're doing great.